Hi, my name's oh, my name's Mark Hill. I'm a claims specialist at the Social Security Administration, right down the street here at 16th and O. And this is Jeff Fox. He's a technical expert there. We have about 32 years of experience working at the Social Security office, and we've both been in Lincoln the whole time. And so we are actually people you can come and see, and you'll actually see our faces there. So I just want to thank the university for having us, for Gail and Diane for having us here to go through Social Security and what everybody can think about when they're looking at filing for Social Security. And there's a couple other programs we're going to talk about that we administer there at Social Security as well. All right. A lot of times people talk about the three stools of retirement. That's usually what they're talking about is your Social Security, your pension, and your savings and investment. We also talk about other income too. You would also want to look at if you have rental income or if you're still working. Any of that also counts towards that. And the reason we talk about that is a lot of times people think maybe Social Security will pay for everything, but really it's only about 40% of what your actual earnings were at the time that you retired. And so people need to be aware that it's not going to be everything. It's not going to be able to pay for everything that you need it to pay for. Now, right now, about 177 million workers are paying into Social Security, and 94% of us are all covered by Social Security. There is a small percentage of individuals that still pay into other programs that are different than Social Security, and we'll talk about that briefly. All right, so about 60 million people are receiving some sort of Social Security or benefit through our programs. That's about 1 in 6 Americans are receiving some sort of Social Security benefit. And so a lot of that is also disability benefits. It can be for children are receiving those benefits as well as survivors receive any type of those Social Security benefits. Now, who pays for it? That's us. We all do. Every time we get paid, we're paying some taxes into Social Security. It's not an actual fund that's sitting there at all times ready for you to take out. It's actually a system where the workers are paying in and then the retirees are taking out of that system at the same time. Now, we have a computation for those benefits, but there's no actual set-aside account for each individual. It's based on a computation I'll talk about here. First, just to qualify for Social Security, you have to have 10 years of work. Usually we'd say full-time work, but really it's not even that much. You just have to earn about 1,360 as a quarter, so 4 quarters, so about 5 to 6 grand each year is going to be enough to be eligible for Social Security. But we don't just use 10 years to calculate your benefit rate. We use the top 35 years of your work. So when people say it's the top 3, that might be some sort of pensions that you might have, but for Social Security, it's the top 35. And how we calculate is we take the average monthly earnings that you had over those top 35 years. So that's 420 months. We're calculating what you had as an average income. We use that number in calculating what your benefit rates are. But one thing about that is that your wages are actually adjusted for today's earnings. So even though you may have only earned, $10,000 in 1970, that may be worth $25,000 in today's dollars. And so we do look and see what you may have earned in the past. It does, when we do our computations, we do index those earnings. This is just the computation, but altogether, you don't have to do any of that math. We have retirement estimators online. You also get those statements that say what your Social Security benefits would be, but it's all based on what you would receive at your full retirement age. Now, that full retirement age has gone up over the years. It's not 65, it's not even 66 anymore. A lot of people are going to be looking towards age 67 before they're at that full retirement age. And like I said, that's the number that your benefit's based on, but it's also when you can actually work and earn as much as you want to and still receive your Social Security checks. And so right now, as you can see, by filing early, there's a pretty hefty reduction in filing for benefits. So if you're filing, at 62 versus 66, there's a 25% reduction. So if your full benefit rate is $1,000, you're only going to get $750 if you file at 62. Now with the full retirement age moving, it's even more than that. It's 30% reduction. With that full retirement age, like I said, there's no limit on your work. Anytime you file before your full retirement age, we look and see how much you're working to be eligible for benefits, because there is an earnings limit. Right now it's $17,640, and how that works is for every $2 that you go over that limit, we're going to end up withholding $1 worth of your benefit check. So That's really important when you're looking at when you want to file for benefits. At your full retirement age, obviously, there's no limit. The year you turn your full retirement age, there is a different limit. It's a much higher limit. So let's say your full retirement age is October of 2019 right now. The earnings limit for the year from January to September is that $46,920. And so just be aware of that when you're looking at filing for benefits. There's lots of reasons lots of different things people take into account when they're looking to file for benefits, and work has to be one of those. Other things people look at would be length of life of their family, whether they need that money right now, whether they can pay rent without having the Social Security benefits. And so people have to make these decisions of whether they want to take that reduced benefit, which it is a lot less, but you're also receiving more checks by filing early. Whereas if you wait later, it's a higher benefit rate, but you gave up on some of those checks you could have received in the meantime. And so everybody has to make those choices all the way to age 70. There are benefits. It goes up 8% per year, pretty much at 66 to 70. And so some people may want to wait all the way to 70 to take their benefits. The retirement estimator, this is online. It actually gives you estimates based on your actual Social Security earnings. What happens a lot of times is those statements that come out, they're estimating that you're going to keep on working at the same rate that you have been working. And so some of those numbers, they're estimates, is all those are. And so if you wanted to get a closer amount, you'd want to be using this retirement estimator to figure out exactly how much your benefit rates would be. The windfall elimination provision is mostly for individuals that did not pay into Social Security the whole time. I'm not going to go through a whole lot of it, but they have a different computation, and they would need to contact us to get a better idea of what their benefit rates would be. There is a calculator online for it, but most of the time people are going to call us to see what their benefit rates would be if they have something like that. Spousal benefits, at your full retirement age, you are eligible for up to half of what your spouse's full retirement rate would be. So if your spouse's full retirement rate was $1,000, you could be receiving $500 at your full retirement age. The issue there is that you always have to file for your own benefits first. So if your benefits are only $300, then yes, you'd get the extra $200 to make it up to that half of what your husband's or wife's full retirement rate would be. They're always reduced if you file early. Same type of thing as retirement benefits. Every month you wait, it goes up a little bit, but every month you wait, you're also giving up a check you could receive, and it's also based on that earnings limit too. You do have an earnings limit for spousal benefits as well. Filing for those benefits doesn't reduce the payment to the individual that you're receiving the benefits off of. So if your husband is receiving that higher benefit rate, it doesn't affect his by you filing for benefits on his record. This is just about that full retirement age again, same type of thing. Every month you wait, goes up a little bit more. And you don't have to file on the year. You can file at 64 and 5 months or 65 and 2 months. It's not going to make any difference. It just goes up every month you wait. Divorced spouses, you have to have been married for 10 years to be eligible for benefits. Your divorced spouse does have to be at least age 62 for you to be eligible to file for benefits on that other record. But they don't have to have filed. You can still file on their record even if they haven't filed for any type of benefits. Same type of work reductions as the retirement and the regular spousal benefits. Deemed filing, this is what I kind of talked about before. If you've worked and earned on your own, you have to file for benefits on your own. Now we are coming up to, this is the last year where individuals at age 66 this year in 2019, they could choose to file for spousal benefits instead of their own. But really in the future, most anybody that would turn age 62 after January 2016, and that's most people now, they're not going to be able to do that. They need to be filing on their own record first. But if their benefit rate is less than half, then we also want to look at spousal benefits. Voluntary suspensions are for individuals usually between 66 and 70. If they go back to work and want to receive that 8% per year onto their benefit rates, they can choose to have their benefits suspended and keep on receiving a higher benefit rate at a later date. It doesn't happen very a whole lot, but there are some individuals that will want to be able to receive that higher benefit rate later. Government pension offset, this is similar to that windfall elimination provision. Like I said, there are some groups out there where they don't pay into Social Security, and if they don't, their benefits are going to be offset by the pension that they receive. And so in this case, if they're filing for spousal or widow's benefits and have one of those pensions, it's offset by 2/3 of that pension rate. Again, these individuals should really contact us to get a better idea of what their benefit rates would be. Survivor benefits, individuals can start receiving survivor's benefits as early as age 60. It's only 71.5% of that full retirement rate, but they don't have to wait till 62. They can file right at age 60. The difference between the survivor's benefits and the spousal benefits is that they can file at 60. It's also a much higher benefit rate than a spousal benefit would be. And I'll go through that in a second here. This just talks about there's a one-time benefit. Sometimes people don't explain very well. It's a $255 benefit if you were living together with your spouse. They paid enough into Social Security. There is a one-time benefit. It's been the same rate for about 70 years, so it really hasn't changed a whole lot. It was supposed to help pay for funerals. Obviously does not do that anymore, but we still do need to get that out to people. The survivor eligibility factors, there's more just than widows and widowers. There's also children. They can be eligible for benefits. Sometimes that's not listed very well, and so individuals, they do need to contact us if they have a child who their parent passed away and they're under 18, they may be eligible for benefits on that record. This also helps with individuals that are disabled before age 22. We call it, usually we say it's a disabled adult child, meaning that they were disabled before age 22. They may be eligible for benefits on a parent's record instead of just filing on their own because they may never have worked and paid into the system. And then, of course, the widow and widowers, they can file as early as age 50 if they're actually disabled, but usually you're going to be seeing that benefit at age 60. This is where I was talking about the spousal benefits. Obviously, the biggest difference is they can file at age 60, a widow can, whereas the spouse has to wait until 62. And again, the benefit rates are much different than if they were still living versus filing for those widows' benefits. One of the big things for widows is that they can actually choose to file for one benefit and then switch to another benefit later. And so that means they could either file on their own record at 62 and wait and file for that higher benefit at 66, or vice versa. They could be filing on that surviving spouse's benefit first and waiting and then switching at a later time all the way up to age 70 on their own record. And so that's something people need to take into account when they're deciding what type of benefits and when they want to file for those benefits. It's important for surviving spouses sometimes to contact us to get those numbers because you're not going to be able to find those all the time on the online estimators, and you're not going to receive a statement showing what your surviving spouse's benefits are going to be. Auxiliary benefits for children. This may make a determination on whether you file for retirement early because children under the age of 19, they are eligible for benefits on a record. So if you're filing for retirement and you have a 14-year-old at home, that's 4 years of benefits that child could receive. There could be some advantages to filing for benefits early instead of waiting. And that's also for those disabled adult children. They would be eligible for those benefits as well. SSDI, this is Social Security Disability Insurance. If you're unable to work, you may want to be looking at filing for this benefit. This benefit doesn't include for people over 66 or over their full retirement age. There is no eligibility for disability. But anytime before that, let's say if you stop working at 62, we'd want to look at retirement, but we'd also want to look at a possibility of filing for disability benefits as well. And what they're looking for is to see that you're 100% disabled, meaning you're going to be unable to work for 12 months or more, or your disability is going to be terminal. In that case, you do want to be looking at filing for disability. It does take longer than the retirement, but in the meantime, if you're over 62, we can actually pay you retirement benefits while you're waiting for that disability decision to come in. The biggest advantages of the disability, it's a higher benefit rate, as well as you may be eligible for Medicare earlier filing for disability. SSI, this is a low-income, low-resource program. It's a federal program that helps individuals that may not have paid enough into Social Security or their benefit rate is very low. They may be eligible for this type of program. Taxation of Social Security benefits. This can get pretty confusing, and a lot of times we don't answer a whole lot of questions with it because there's actually people that work with your taxes and work with the taxation of the benefits. But altogether, what you're looking at is that 85% of your benefits may be taxable. And so how they take that into account, here they're just looking at their federal tax return as the combined income, which is actually the next page here. They take your adjusted gross income and that non-taxable interest, plus half of your Social Security benefits to determine which one of these groups that you actually fit under. And usually it means up to 85% of your benefits may be taxable. But that's, again, you're going to want to talk to whoever does your taxes to make sure. You're going to get a 1099 at the end of each year in January showing what your benefits were for the year, and you actually turn that into whoever is doing your taxes, or if you're doing it yourselves, you just add that on. The calculators, the biggest one is the retirement estimator. There are other calculators on there that talk about life expectancy, the earnings test, benefits for spouses, but really the retirement estimator is what you're going to be looking at to see what your benefit rates would be. I know they talked a little bit about Medicare earlier, but I'm going to talk just some basics about Medicare here. The Medicare Part A is the hospital insurance. It's free at age 65. Unless you have a health savings account, usually individuals sign up for that Medicare Part A, even if they're still working. It's just a secondary insurance. It's free. It pays for the hospital. A lot of people are going to sign up for that. Now, if you have a health savings account, it may not be something that you want to be filing for at age 65 because it could affect your eligibility or your tax implications by having that health savings account. The Medicare Part B, that's the premium-based Medicare. It's for clinical insurance, going to the doctors. It's $135.50 a month right now. How that works is if you're still covered by health insurance at work or through a spouse's employer, you may not need that Medicare Part B right away at 65. And so it's something you need to decide whether you need to be signing up for that at 65 or if you want to wait. How that works is if you tell us if you're already on benefits beforehand at 62 or 63, the Medicare will actually come to you automatically, and it'll have both Medicare Part A and Medicare Part B. And you'll need to know whether you want both parts of that at that point. Otherwise, if you're going to be waiting till after 65 to file for Medicare, you do need to contact us to file for Medicare. I'll talk about a little bit about how to file for Medicare in just a second here. There is a Medicare Part C. This is a private insurance company that have bundled Medicare with some supplements to go along with the Medicare Part A and B, as well as there's a Medicare Part D, which is the prescription drug plans. It's going to be a variable premium depending on what medications you're taking and which provider you want to go with. But both that Medicare Part D, the supplement, and that Medicare Part C are all through private insurers, not through Social Security. One thing to keep in mind with Medicare is that your date of birth is really not your date of birth. So how that works is that the first of the month, if your date of birth is on the first of the month, like October 1st, we actually consider you 65 the month before. And so that does catch up some people when they're looking at filing for Medicare because really they're going to start their Medicare 1 month ahead of time if their date of birth is on the first of the month. The Medicare usually comes at 24 months after being on disability or age 65. Most of individuals, it's going to be that age 65. There are a couple other reasons you'd be eligible for Medicare earlier, including having dialysis or ALS. To sign up for Medicare, there's the initial enrollment period. This is usually when people sign up. It's about 3 months ahead of time before you're 65 and the 3 months after. There's also the special enrollment period. These are for those individuals that are still covered by their group health care plan through their own employment or their spouses. Once they're done working or their spouse is done working, you need to sign up for that Medicare Part B, and you have 7 months to do so. That way you don't end up with any penalties onto that Medicare Part B or anything like that. But that's the premium-based $135.50 that you'd be signing up for. The general enrollment period, if you don't fall into either of the other two, we do have to sign you up January through March of each year, and it doesn't actually start until July. So you don't want to be using the general enrollment period if you can help it. The Part B coverage, it just talks a little bit about here when you're signing up for it. You do want to do it before 65, so it'll start right at 65 if that's what you're looking at doing. Otherwise, if you're still covered, just let us know when you want to file for it. You can call us and we can send you the forms. Otherwise, there are forms that you can find online to sign up for the Medicare Part B. You fill those out, send them in. Pretty much it's going to be a form that shows that you've been covered the whole time by your employer is what we need. The Medicare Part B, if you have a higher income, there is a higher premium attached to your Medicare premium. So if you do, as a couple, have over $170,000, you're going to be paying more than the regular $135.50. But that only lasts until you're done working or done having that type of income coming in. So if the only reason you have that higher income is because of work, you'll need to let us know so that we lower your premium back down to the regular rate. Medicare applications, this is those two forms I was talking about, the Medicare, the CMS 40B and the CMS 564. That's all we need to get the Medicare Part B. And like I said, you can get that online or call us and we'll send it to you. The Medicare Part A, most people do sign up online, but you can call us and set up an appointment. We just do an appointment over the phone or in the office and go through that application. You can't even stop in our office, and Jeff will talk about this a little bit more, but there are some computers set up that you can apply for the benefits right there if you have one of those My Social Security accounts. Even if you don't, we'd sign you up for an account there. The Medicare card, this is just a new information. We used to have all the Medicare cards had your Social Security number on it. If you still have a Medicare card that has your Social Security number on it, you definitely want to contact us. All the Medicare numbers have been changed, mostly to protect your identity, because you do need to be carrying the Medicare card, but you don't really need to be carrying your Social Security card anywhere. The Extra Help Program, this is for that Medicare Part D, the prescription drug plan. And it really depends if you have low income and low resources, this could be a good program, a good windfall for you, because it would help pay for that Medicare Part D for you. And so you can either sign up online or contact us, and we'd take the application over the phone or in the office to help you get help paying for that Medicare Part D. I'm going to have Jeff talk to you a little bit about applying for benefits online, but real quick, do you have any questions? No? Okay, go ahead.
Sorry. I'm a little bit taller, so I need to hold on to it here. So, all right. All right. So as Mark said, there are ways to file, 3 different ways to file for Social Security benefits. So the fastest way right now is online. You can do it at the convenience of your own home, and it's a lot faster. You usually get a decision a lot quicker. However, if you do not wish to file online, you can still give us a call, and we'll set up a time to take that application over the phone with you. Or you can come into the office, or we'd prefer you call and set up an appointment before coming into the office. You could be waiting a little while if you're doing that. But if you wanted to file online, you can file online for retirement benefits, Medicare benefits, spouses benefits, and then also that extra help. So you can file for those options online. If you're filing a survivor's benefit, or if there's children involved, those still have to be done either over the phone or in the office. All right, this is kind of the My Social Security account homepage. Who here has a My Social Security account set up? Well, that's great. That's even better than the first group. So that's excellent. So obviously the benefits for having a My Social Security account, if you're receiving benefits, there's a lot of things you can do. You can get a benefit verification letter as proof that you are getting benefits. You can check your benefit and payment information, change your address, change your phone number if you needed to, start and change direct deposit. You can also request a new Medicare replacement card. Or get a replacement 1099 for taxes. So it's a really good opportunity to do that if you, as you know, our hours are 9 to 4, so it's kind of hard to get a hold of us sometimes. So if you have a My Social Security account, you can do a lot of that from home when it's more convenient for you. You can also request a replacement Social Security card if you have a My Social Security account. There are some restrictions, but for the most part, it's working pretty good. Everyone seems to be happy with that service. Even if you do not receive benefits, you can still do a lot if you have a My Social Security account. Again, you can request that new replacement Social Security card. Also, if you filed for benefits, you can check the status of your application, see where it's at. You can also, sometimes when you get to a certain age, a bank might not believe that you're not on Social Security benefits, so you can print off a letter saying that you're not getting benefits. And then you can also get your Social Security statement to review. So those of you who have a My Social Security account, you probably haven't gotten those yearly statements showing how much you've worked and paid in over the years, but you can get those online. And the nice thing about it is it's a real-time update, so it doesn't update just once a year. So you can check it at the beginning of the year, and then you can check it near the end of the year to see if the IRS has reported the correct earnings to us. We've recently added some extra security for those Social Security, My Social Security account. The first layer of security is your username and password. That's the first layer of security. After you enter in your first layer of security, you will either get a text or an email saying and they'll give you a specific code, and you have to enter that in next. It's just another way of just protecting you guys, protecting the public if we can, just to make sure everything is done right, to make sure we're talking to the right person. And so when you want to open up your My Social Security account, you'll go to that website, socialsecurity.gov/my account, and you'll create an account. You'll provide some of your personal information to us, and you'll create your username and password and select how you would want to receive that code. So if you have a phone that takes text messages or receive an email, whatever you prefer. Now, when you create a My Social Security account, you are creating it for yourself. You know, it's not our Social Security, it's my Social Security is what they have it on there. But you can assist somebody if they're with you, if they have their own email address, and they can answer those out-of-wallet questions themselves. But you can't just set up an account for anybody you wish. So you can't set it up for your parent just to be able to figure out what their benefits are doing. You can't set it up for a child if they're receiving benefits. It's really your own benefits that we're looking at that you can use that My Social Security account for. If you're having difficulty still setting up that My Social Security account, it's usually those out-of-wallet questions which throws everybody off. If you can't get online and you can't do it at home, if you can come into the office, we can bypass all of those security questions for you. As long as you have your state ID with you or your U.S. passport or some other form of U.S. Identification, then we can bypass those security. We can actually walk you over to these computers. We have 3 computers set up, and we'll help you set up your username and password right there in the office. And it usually goes pretty smooth when we can do that. All right, so who here has recently got a phone call saying that their Social Security number has been suspended? Yeah. So unfortunately, in the last couple of years, we've seen a very large uptick in this type of thing, in these types of phishing scams and everything like that. And they're pretty convincing, you know. And I had a guy call me the other day. He was a friend from church, and he asked me, hey, I got a call from Texas, and then I got a call from Nevada saying that somebody was using my number in Texas. So they're getting really good at what they're doing. Unfortunately, and I told him, I said, that is a scam because we will never do that. But make sure that when you get something like that, make sure to understand the threats, exercise caution. You can never be too cautious with that, and secure your information. And I do believe you have the slide show up. So there is a bunch of numbers that are going to be coming up here to report the fraud. This bottom number here is is for the Office of the Inspector General, and they're kind of our police arm. They kind of investigate Social Security fraud. That's who you would call. So if you do get a phone call, I recommend calling that number or going to the website to do that. Know that we do contact individuals on the phone sometimes. Usually, if we're contacting you, you would know that we are doing business with you. If you set up an appointment with us, but that appointment's a couple of months out or 1 month out or something along those lines, we may try to call you early to get that appointment done for you. So that's normal. But we will never threaten you for your information. If we do, we will not be working there anymore. But we will never threaten you for information, and we will not state that you face any potential arrest or any other legal action if you fail to provide us information. So if you get something like that, it is a fraudulent call, and you should just hang up. Do not give out any of your information to anybody. We have people that call us on a regular basis, and they're like, well, I told that person, and gave them a piece of my mind. Like, don't do that. Just hang up the phone. Just hang up the phone, and do not give us iTunes gift cards. Do not do that. That is definitely something that we do not do. All right. Unfortunately, again, one thing that we do run across in our job is we do see a lot of elder abuse and exploitation. The biggest key, and Floyd just talked to you guys about it, stay connected, prevent isolation, and learn to spot those red flags. Avoid sharing any personal information, especially with people you don't know, and sign up for direct deposit of your benefits. And when you file an application with us, we're going to ask you for your direct deposit information right away. So we want to make sure everything's deposited into the safest bank account that you can get into. Also, if you have questions or something seems kind of strange, consult with somebody you trust. Shred any financial documents that you do not need. And like I tell my kids, if it sounds too good to be true, it probably is. And so if you suspect fraud, there's a few ways to protect yourself. The first thing to do is to get on the National Do Not Call Registry. And again, you'll have the slideshow available, so you'll be able to get all these numbers. But register your phone to kind of cut down on those telemarketing calls. So if you get a call, that's a telemarketing call, they say it's from us, you can probably assume that it's a scam in that regard. Again, you can contact the Office of Inspector General if you suspect any fraud. If you suspect any elder abuse, contact that number or contact your local authorities as well too. And unfortunately, again, another thing that we see is identity theft. And in 2017, about 16.7 million people were victims of identity theft. And last year, in 2018, there were 3 million reports of fraud. And it is definitely something, again, that's on the rise. And here's some examples of what is going on, and we all know the impact that we have. And unfortunately, a lot of times people don't realize that they've been a victim until it's too late. But what Social Security does is Social Security tries to protect your information as much as they possibly can. We protect your Social Security number. We keep all your records confidential. We are not allowed to share your information with anyone else. Again, be careful about sharing your Social Security number even when you're asked for it. So if you go to a place, and we've talked about this in the previous session, but if you go somewhere and they say, I need to have your Social Security number, it's always okay to say, why do you need that? Because maybe they don't know if they need it or not. You know, you can always push back a little bit on that and just say, why do you need to have that? Now, if they have to do a credit check or something along those lines, yes, that's part of their business process, and yes, that is legitimate. But again, you can always ask, why do you need to have my Social Security number? Yes, ma'am.
I find that a lot of doctors' offices, they always ask for Social Security. What do they need it for?
So the question is, or the comment is about the doctor's office, and everybody are now asking for your Social Security number. And do they need that? Why do they need that? I think the reason why they need that is, honestly, I think a lot of it has to do with billing now too. If people are skipping out on their bills, who do they report that to? And to kind of have credit, or have the debt collectors go and look for those individuals that are missing out on that. But it's always a good question to ask them and to say, why do you need my Social Security number? They have everything else if they're your doctor. They know way more about you than they need to, but that's their doctor. So when it comes to your Social Security card, always keep them in a safe place. Do not carry your Social Security card in your wallet. I don't know how many people come in with this card that's all old and decrepit, and they're like, I need a new card. I'm like, you shouldn't be carrying this one anyway. So do not carry your card. The only time you'll need it again is if you're applying for a new job, or if you are probably setting up something with the bank or anything along those lines. What to do if you suspect fraud? Number one, call the companies where you know the fraud occurred. Second thing is to place a fraud alert and get your credit reports. And then report that identity theft to the Federal Trade Commission at identitytheft.gov. If you do contact the credit bureaus, just know that if you contact one credit bureau, the other two are alerted already. So if you contact Experian, Equifax, or TransUnion, if you contact one of them, the other two will be notified as well. If you're like me, I would probably call all three just to be safe, because that's just how I think. But you definitely want to at least call one of them at the bare minimum. When you go to identitytheft.gov, it's going to take you through a process. You're going to explain what happened to them. They're going to get you a recovery plan, and they'll create a personal recovery plan, and they're going to put that plan into action. And that personal recovery plan will walk you through each step that you need to do. They'll create an identity theft affidavit that you can review and update at any time. And they'll also give you customized pre-filled letters to send to credit bureaus or other businesses and debt collectors to kind of explain what happened. It'll update your plan and track your progress, and it'll give you advice about what to do if you're affected by any of those specific data breaches. What Social Security can do for you is if you're a victim of identity theft or fraud, really, we try to reach out to you the best we can and give you the information on where to go and how to report that information. We can also give you a replacement Social Security card if you've lost one or it was stolen. In very rare cases, we can issue a new Social Security number, but we'll also verify your Social Security records. So if you say, well, I think my bank account is XYZ, after we verify your identity, we'll be able to look that up for you and make sure that's accurate. We can sometimes correct your earnings record if somebody has stolen your Social Security number and is working under that number, and the IRS says, where are my taxes? And we can correct your Social Security record if we needed to do that. And we can also refer things to the fraud hotline as well. But what we cannot do is, unfortunately, we cannot correct your credit record. If your credit has been ruined by identity theft, there's nothing we can do about it, unfortunately. We can't file any identity theft reports with the police. And we can't act as an advocate. Again, the credit bureaus, Equifax, Experian, TransUnion, they have a good website. Each of them have a really good website to go onto and tell you what to do and the next step that you need to take. Again, at the bare minimum, if something happens, contact one of them. But I would say contact all three. And there's other resources here, the Federal Trade Commission, the IRS, if there's something going on with, you think there's something going on with your taxes or tax return, the DMV fraud hotline. And again, once a year, you are entitled to a free credit report once a year. So definitely sign up for that at theannualcreditreport.com. So On that happy note, do you guys have any questions for Mark or myself? Yes.
Yes. If a person passes away at a hospital in the evening, and the next morning the spouse goes to the Social Security office to report it, and they already know, how does that work?
So the question is, if a person passes away at a hospital in the evening, and then the spouse goes the next day to Social Security to report that, sometimes we know that. How we are notified by the state. The state is notified by the hospital, yeah. So
So they just do it, the hospital does it immediately?
the hospital does it immediately, yeah. It's pretty fast. And in Nebraska, we have what they call electronic death registration. So any sort of funeral home, anything that's notified, that once the state finds out, we find out. So it goes pretty quickly on that regard. Not usually next day, but it can. Yeah, it can.
Yeah, go ahead.
If I reached full retirement age, was receiving benefits, and then continued to work, if my index earnings for a year after that happened was greater than any of the 35 years of indexed values for those years, is that benefit then recalculated?
Yeah.
Yeah, so the question is how work affects your benefits after you're over 66, if it actually determines a new benefit rate. And yes, every year you work, if it's one of your top 35 years, it's going to change your benefit rate. The issue is if you're only working maybe, $2,000 or $3,000 is all you made in a year, that may not make any difference at all. But yes, if you work and it's one of your top 35 years, we're going to recalculate those benefits. And we get that information from the IRS. Otherwise, you can always give us that information at the beginning of the year, and we can get it figured out right away in January. Yeah, go ahead.
Follow-up, so if you retire before having worked 35 years, and the last year of your service is half-time, half-salary, will that lower your Social Security rate going forward?
The question is about if there's additional earnings after you've already had the 35 or less than the 35 years, and you've added more earnings, right, even after 65. And the answer is yes, it still is going to increase your benefit rate. So if you only have 20 years of work for some reason, every year you work, even if you're 68, 69, and you work and pay more into the system, it's going to adjust your benefits because they're going to recalculate your benefits to give you credit for every year that you've worked if it's under 35. Go ahead.
If you retire before your full age, well, mine is 66, I'm thinking retiring at 64. Do I have to immediately file for Social Security, or could I wait till I was 66 and get the full benefit? How does that work?
Yeah, the question is if a person decides that they want to retire prior to their full retirement age, do they have to take their Social Security right away? And the answer is no. That's your choice on when you want to take your benefits. So you could retire at 64 and just live on savings if you wanted to until you hit your full retirement age and then jump on over at that time or earlier or later, however you choose. It is totally your choice. We're not going to make anybody file for Social Security if they don't want to file for it, unless there's other exceptions. Anyway, yes, sir.
Oh, just as a general guideline, you said that, an estimate would be that your Social Security would be 40% of what you're currently getting, your current monthly salary.
Yeah, so the question was, he had a question on how much Social Security is supposed to replace of your current annual salary, and the general rule is about 40%. That's what it was designed to do, right?
Is that of your take-home pay or your total gross pay?
I would say probably your take-home pay. Is it 40% of your take-home or is it 40% of your gross pay? I would say it's probably 40% of your take-home pay.
Any other questions?
Oh, we got one.
On the spousal death benefit, if you're making your normal salary, is there a limit on the amount that you can make before you can grab your spouse's death benefit?
Yeah, so the survivor's benefits, you were asking whether or not your earnings make a difference if you're taking it prior to your full retirement age. And the answer is yes, your earnings do make a difference. on some of it. Now, that lump sum payment of $255, which again is $255, we don't care what you're earning. We're going to pay that out to you at whatever age, whatever earnings you make. That doesn't affect you. But if you take it earlier than, if you started at age 60, then yes, it would be reduced, and then that earnings limit that Mark talked about of that $17,640 comes into play. However, if you think that's still an issue, we still want to talk to you because there might still be a possibility to receive some checks every year. So if that's ever a possibility, call us and we'll break down all the figures for you and say, based on your earnings, this is how many checks we have to withhold, and you'll get maybe 4 or 5 checks a year still, regardless. So we definitely want to talk to you about that. Yes.
I understand, I've been married for 4 years, and I'm divorced, and I understand I can, collect on some of his benefits, correct?
Right. The question is about being married and being eligible for divorced spouses benefits. Yes, you just have to be married for 10 years, but to file for that, you do have to be unmarried. You can't have remarried. Okay. Sure.
But my question is, I understand that there's a change, because you're born on and before, April 1st, 1954, or is January, there's a change.
Yeah.
There's a change in that.
Sure. The question is about the change in the law for people that were born after January 1st, 1954. All that was when we were talking about the deemed filing, where you have to file for your benefits first on your own record. How it works now is that if you're over 66, you have to file on your own record first. The only people that do not have to file on their own record first are those people born before that date. They can choose to file for spousal benefits or divorced spouses benefits and then switch at a later date to file for their own benefits. But most individuals are no longer under that category. All right, I think we're good to go. Thank you for having us. Thank you very much.